All right, welcome to this live broadcast. Time for our conversation right now, where we center it around issues to do with antimicrobial resistance. My guest is already here. That is NQOBILE NDLOVU, who is the CEO, Africa Society for Laboratory Medicines. Did I first pronounce that name correctly?
Thank you. It is.
All right. So let's just quickly get into this discussion. And first of all, begin by understanding what is this antimicrobials? What are they? Are they same as antibiotics? What exactly is this?
So when we are talking about antimicrobial resistance, we are talking about organisms that are developing resistance to the available drugs and treatment. So over time, what happens, be it viruses, be it bacteria, be it what we call parasites, be it what we call, bacteria and other microorganisms. So over time, because people are using antibiotics recklessly, they develop resistance. And that is a big global public health threat, because the available medications and drugs that we have are not able to work next time people go to the hospitals for treatment. And it's becoming a problem because the current statistics are showing us that around 200 people are dying every day because of microorganisms that are not treatable anymore.
This is 200 people every day in Kenya, globally?
It's globally.
Globally.
Yeah.
So this accounts to about, what, 700,000?
Yes.
Annually?
Yes.
Now, with just what you're saying and looking at that figure as is, what is the projection like? Is this number perhaps, does it portend to increase, reduce, stay the same? What does data say?
So according to the 2019 statistic, around 1.3 million deaths were attributed to antimicrobial resistance. And the unfortunate part is that Africa is bearing the greatest burden on mortality. Around 27 persons are dying per 100,000, which is a big contribution that is coming just from Africa. So when we are talking about the problem of antimicrobial resistance, we are not talking about something that is in the future. It is already in Africa, and Africa is already paying the price. And as a continent, we really need to take action and begin to pay attention to the issues that are coming with antimicrobial resistance. So when you're looking at some projections, it is projected that if we don't do anything about antimicrobial resistance, by 2050, around 10 million people are going to die due to antimicrobial resistance. So that is the mortality, but also it has got health cost implications. So if you're looking at the health costs, we are looking at $1 trillion of additional health costs that are going to be incurred if we don't do anything about antimicrobial resistance. Talk about global production loss. It is estimated to be like $100 trillion by 2050 if we don't do anything now in terms of antimicrobial resistance. So it's a big challenge. It's a growing global public health threat that we need to address, and we need to address it now.
So the ripple effect is quite huge.
It is.
But then again, help us understand, why is Africa bearing the biggest brunt of this? I'm so sure we are not only the ones who take these antibiotics in excess, but why is it so Africa?
One of the greatest challenges we are facing in Africa is not understanding what we are dealing with. And by that is we have poor surveillance systems. We don't know what are those organisms that are circulating in our populations, and which drugs are working and which ones are not working. So we have poor surveillance systems. We have poor laboratory diagnostic systems. We also have the tendency of people just taking drugs without treatment. So that has exacerbated the situation and the challenge. But the good news is that we, as the African Society for Laboratory Medicine, ASLM, working with our partners, the Fleming Fund, UK, we have managed to collect information and data to understand the burden of antimicrobial resistance in the continent. So we do have an Africa data in terms of what are we dealing with and where are the gaps and where are the challenges. So that is the good news.
Yeah.
And the good news also is that AU has stepped up and is now taking the leadership. We have what is called the AU Landmark Report that was presented in the United Nations General Assembly. And this report really expressed the political commitment of member states in Africa. It also understood the burden of antimicrobial resistance. And also it expressed the experiences of the African countries in terms of MR, and also called for agents in terms of addressing and financing. So this is a situation, this is a challenge that as a continent, and under the leadership of AU, under the leadership of Africa CDC, the member states are coming together to express and begin to draw agency in terms of coming up with targeted interventions and addressing antimicrobial resistance.
Okay, so the reason as to why Africa is one of the continents bearing the biggest brunt, according to what you're also saying, is part of it is poor diagnostics. Is that the reason why we also will be having this convention that is beginning tomorrow? Does it feed into that? Exactly that.
So I want to appreciate the government of the Ministry of Health, Kenya, for really co-hosting this 3-day meeting. And this meeting is going to be focusing on accelerating diagnostic innovation and collaboration to combat AMR and advance health security in Africa. So this is a 3-day meeting, and our main goal is really to showcase what are these diagnostic tools that we need to combat AMR. What are these testing machines? What are the innovations that we need so that we can have good intelligence? We can understand these microorganisms as they are resisting some of the available drugs that we have. So we want to do that. Secondly, in this meeting, we want to advance our collaboration. So when we are talking about antimicrobial resistance, it's not a human health issue. It is also animal health because they use antibiotics.
Yeah.
It's also an environmental issue. So we are saying, let's come together as sectors. Let's have targeted interventions. But this collaboration is going beyond just some interventions. Let's also have sustainable financing. We are experiencing a shift in global financing landscape. So as a continent, as member states, we need to begin to take ownership in terms of addressing our issues. Let's come up with innovative financing mechanisms to sustain some of the gains that we have achieved so far. Like I said, through the funding of Fleming Fund UK, we have made some improvement, we have made some gains, which include improving surveillance so that we have got good intelligence to understand what are these bugs that are in our populations. We have conducted trainings, we have conducted data improvement in terms of collecting, and also developing the laboratory infrastructure. So we have a starting point, we have gains, and we have to maintain those gains. So we are saying, let's come together. How can we sustain what we have done so well so far?
Let me stick on that maintaining of gains, because I know that oftentimes, especially when you talk about Kenya and by extension Africa, the question of funding always comes to the fore. It's one thing to achieve, but then maintaining it because of funding always poses a challenge. Yeah. What does the future look like in regards to that?
So there are two things. I think number one, as the African Society for Laboratory Medicine, ASLM, we want to make a call to the governments, which is now a continental discussion to say, as Africa, we need to fund our own solutions. So we are making a call to governments to put in their domestic resources. Make AMR, make diagnostics integral part of your health security plans. We cannot deal with what we don't know. And diagnostics are the foundation. They are the center of understanding what are the problems we have. So that is the first call. The second call also is to our friends, to our donors. We are saying, let's shift from investing in short-term programs. Let's begin to invest in sustainable, long-term systems. We want to be able to sustain the systems ourselves even after the funding has gone. So there has to be that collaboration to say, what are the priorities of Africa? What are the foundational issues we need to invest in so that as governments we can take up and sustain that. So those are the conversations that are happening now at continental level.
I really hope the leaders can hear, because with the numbers as they are and how the projection looks like, if nothing is done, then we are really in a bad state as a continent. But also, there's antifungal for fungus, there's antivirals for the virals like the flu and the likes. But there's just a tendency of concern being around antibiotics. All these antis, but antibiotics. What is so peculiar about antibiotics?
Well, I'll answer you in a holistic way. So when we are talking about antimicrobials, we are including antivirals, antifungals, antibiotics.
Okay.
But the general tendency that we have seen in our communities is that people really are taking more of the antibiotics. For example, during flu, people just go to the pharmacies and they get antibiotics. You cannot treat a viral infection using antibiotics. So our call is that communities have to be aware. The clinics, the doctors, the nurses, the practitioners, we need to take stewardship over the limited drugs that are available for the continent. If we lose their effectiveness, the second line of drugs are very expensive, and that is going to be costly. So it is really changing our behavior. It is also enforcing regulations in terms of what drugs to be used at what level.
So with this sensitization, what else are you peaking? Because sometimes there's the case of even health practitioners. For instance, a mother will go to a facility with a child, they want drug X because of a flu or something, but then even the health practitioner will be the first one to say, get this antibiotic, it will be quick, in easing that pain or whatever it is that they're going through. So really, who are at the front line in this? Is it just the individual or also health practitioners? What are you peaking?
I think it comes back to the investment that we are calling for as ASLM. Let's invest in diagnostics.
Okay.
Sometimes at a lower level where the diagnostics are not accessible, there is that tendency to then prescribe because there is no test available to help the clinician to understand what they are dealing with. So they tend to prescribe, broad spectrum antibiotics to try and help the patient. It is because we are not investing in diagnostics. So diagnostics are at different levels. There are diagnostics we can use at community level. Point of care that can quickly turn around the results, and the doctor is informed in terms of what exactly to prescribe. So if we are to make bold decisions moving forward to address the antimicrobial resistance issue, we have to work together. Those that are seeing the patients at policy level, at investment level, so that we are not assuming anymore moving forward, but we are precise. We know what we are dealing with. We only use the drugs when we know we are dealing with a certain microorganism.
So then also this just, again, boils down back to proper diagnostics. All right, then help us also understand what are the dangers of, long-term dangers, I should say, of self-medicating. It's sort of common with, I don't know if it's us Africans or it's across board, but really what are the dangers, long-term dangers of this?
So the long-term dangers, coming back to what we are talking about and why we are here in this meeting, is we are going to have drugs that can no longer work when you show up in a hospital. When you talk about antimicrobial resistance, it's a very silent pandemic. It's not so obvious like COVID, these pandemics. But it is slowly eroding all the investments that has taken decades. Talk about the discovery of drugs. Next time that same drug is not going to be effective. Then if you go to the second line or the other drugs that are reserved for last line, those are very expensive and we cannot afford it. Our communities cannot afford it. So we want to preserve what works and what is affordable. So we have to come together as a community, realizing the danger that we are going to die from things that are preventable. Some of the deaths that are happening, the 200,000 I was talking about happening every day, those are preventable. But we have lost the effectiveness of those drugs. So let's preserve the drugs that are there to protect us. Let's use them when they are needed. So it is a call to the pharmacist, to the prescribing doctors and nurses, to everyone, the industry partners, to say, let's come together. Even the community. Yeah. We are calling for the community to participate, to desist from just, going across to the pharmacy or even sharing drugs, or even, strengthening the enforcement of our regulations so that it's very difficult to get a drug if you don't have a test, if it is not prescribed by the doctor. So at the center of all, we need diagnostics.
I hear you. And now as we wind down in less than a minute, so an individual who is now antimicrobial resistant, someone who's now resistant, let's just say they are, what is the next line of action for such an individual? Are they just left to die until perhaps research is developed? What really happens to them? They've taken the line one, nothing is working for them, literally. What happens to this individual?
Well, we have had cases of what we call, extreme drug resistance. For example, TB. Yeah. It is already happening. So of course, research is very important and is continuing to come up with new, tools, new drugs to deal with these extremely resistant microorganisms. So there is still hope because the research is still going on, and we still do have drugs that can help those, but we try to contain that particular microorganism. So if we do have good surveillance, then we know it is already starting to be circulating in the population, and we can save many people that can get that particular drug, and it will cost us a lot.
So in the interim, they can still be alive as research continues to be developed?
They can still be alive.
That's what I really wanted to know, because with the data, just trying to see, for those who are now resistant, what happens to them even as this continues. Nonetheless, thank you so much, sir, for your helpful insights, and wish you the very best in this convention as it begins tomorrow all the way through Friday.
Thank you.
That has been NQOBILE, CEO, Africa's Society for Laboratory Medicines, just conversing around antimicrobial resistance and what it portends for Kenya and by extension Africa in the near future. Now we continue with the day's stories and